Hi, this is Dr. Nate at Bright Eyes Family Vision Care and Bright Eyes Kids. I'm happy to announce that both offices are opening for routine care on Monday, May 11th. Yesterday, Dr. Beth and the staff and I did a video explaining the process that we are using to keep staff and patients healthy in this time of COVID-19. That video was a little bit longer. You can find it on our Facebook page. We took that video and we shortened it so you can learn everything that you need to learn to prepare for your visit. If you have any questions, give us a call at 813-792-0637, or you can always email us at office@brighteyestampa.com. Thanks. And the very first thing you're going to do when you walk in, before we do anything else, is we're going to have one of our assistants, in this case, Lech. Hi, Lech.
Hello.
He's going to be taking your temperature with an infrared thermometer. Now,
the next thing is we're going to head down the hallway to wash our hands. And then you can follow Lech into the next room.
This exam room, I will have you have a seat here. I will then walk over, grab the alcohol wipes, clean off the machines right in front of you. Make sure you clean off both sides. If we are doing photos for you, I'll go ahead and clean off this machine over here as well. Once you're over with that, we'll have the patients take their measurements. Once we're through with that, we'll go into the exam room.
So a few things to mention here. You'll notice that right up until this point, there's no signing of anything. And to minimize contact, because like I said, all the paperwork's going to be done online, we're going to bring you straight in here. There shouldn't be any waiting because we've got a schedule that allows you to come straight in. You shouldn't need to really touch anything or sign anything or really do anything. And then that should make everything go a lot smoother. Secondly, I specifically want to talk about the retinal imaging or retinal photos. Sometimes when we have to dilate your eyes, it means more contact with you, and also we have to get much, much closer to you to see the full image of the inside of your eyes. So there are some cases where we will use the retinal photos, get a very good image of the inside of your eyes. We'll talk to you about that. And during this time, we might do that in lieu of dilating you. That's a case-by-case basis, but we want to consider that an option just to limit our contact with the patients. I add that the entire room will have been cleaned after the last patient and before you come in, but we're going to clean it again in front of you, any of the equipment that we're going to be using, just so that you can be rest assured that everything is completely clean.
One of the great pieces of technology that we've had for years is our digital phoropter, and this looks a little different than the machines you might see in the other rooms, and the keypad for this is actually here across the room. And so being able to be in this room for exams allows us to distance even more, so we can control the buttons from over here while you're looking through the lenses to determine any kind of prescriptions. So this is things you've already seen for years. This is what you're used to, but it's great that we have this now to give us a little space.
You want to add anything to that, Dr. Beth?
Yeah, the staff really has spent a lot of time prepping before any patients have come into the office to make sure that we've thought through every aspect of coming in all the way through the office.
So, after the exam's completed, we've addressed any concerns that you've had, we've talked about your options, we've collected all the information that we need to collect, then the doctor will excuse themselves and leave you here just for a moment. And then we will get one of the staff members, which is typically one of the opticians, to see you next. And so we will communicate to them exactly what the status is. Then the optician will come in and they'll get you. They'll introduce themselves and they'll go over any concerns you have in the exam room. And then they will escort you out front. So let's go.
Here we have the frame area, and you would try on frames and place them in this basket once you're done, so we can thoroughly disinfect all of those frames.
One other thing that we've adjusted is during our checkout process, We've moved our credit card swipers so that you can swipe your own credit card, just to minimize handling things.